Dr. Ryan Welter here. We have a patient here. We were just getting started and I thought I'd want to stop to just demonstrate something we see a lot of. So if you want to come close, this patient had a previous strip surgery. Now we'd already gridded him up, but I erased where the grid was. Basically the strip scar goes along here. And what I want to demonstrate is that after previous strip surgeries, this is just one surgery, a lot of times the vascularity is hindered because of the stretching of the scar. So the scar will make the skin a little bit less lax over time, and because of that stretching, sometimes the vascularity is impeded, and that leads to sometimes basically some depletion of the donor area. And you can see here, this is very thick here above the scar, but as we get below the scar, you can see a lot of thinning that has occurred from the stretching that's happened, and it's just pretty evident in this patient if you look at these two grids compared to down here. It's another reason we try to avoid repeated strip surgeries in patients. We like to do the FUE. We're just so well versed with that, and the healing that we have now is just, I think, much superior to the previous FUT techniques in most patients.